As the American Society of Plastic Surgeons celebrates 75 years, we salute our members and those who led the way.
The early plastic surgeons were groundbreakers. They invented procedures, and by doing that, they advanced a whole new specialty that over time has grown.
We need to build on the foundations of all of those people that have come before us. Even though the techniques have changed, basically the underlying foundations of plastic surgery are the same.
Plastic surgery is kind of defined by those individuals who look at difficult problems and come up with ways of solving them. And that makes it kind of a unique specialty.
The first plastic surgery textbook is now out of print. It was written in 1597.
If you look in that book, there is a particular type of flap procedure where you transfer tissue called a Tagliacozzi flap. It's an astounding example of innovation to solve a problem. Taking the tissue from the biceps area, actually sewing it up here to the nose.
When John Peter Mettauer was ready to perform the first cleft palate operation in the New World, he first had to make his own instruments. Plastic surgery wasn't easy in 1827. The earliest known breast augmentations were done in 1895, using materials such as paraffin, beeswax, and vegetable oil. Unfortunately, wartime was boom time for plastic surgeons. World War I and II caused more and more extensive facial and head injuries than we'd ever known. Plastic surgeons restored function and dignity to thousands of young men with long lives ahead of them. And so it is again.
In the First World War, because of the trenches, the injuries were to the face. And now, with all the body armor, injuries are again to the face. And so we're training a whole new generation of war surgeons in how to take care of these very, very challenging wounds.
The concept of saving an extremity rather than amputating it, the concept of reconstructing a foot or an ankle rather than amputating it certainly has tremendous lifelong implications.
From adversity has come innovation. Skin grafting, burn treatment, limb repair and reattachment, and craniofacial and cosmetic surgery have all advanced dramatically.
Every plastic surgeon, I think, has an element of creativity within them. And what sets them apart from other surgeons and other physicians is their ability to use that creativity in a positive way for a positive outcome.
The most formidable medical contribution to be made by a plastic surgeon took place in 1954, when Joseph Murray performed the first successful live organ transplant. His groundbreaking work earned a Nobel Prize and is responsible for saving more than 400,000 lives so far.
I think we're going to get to the point where we can tighten up skin just using the laser and not necessarily doing surgery. I think we're going to get to the point where we can cure some of that cellulite that women are always so worried about. And I think that we're going to be able to operate on patients in utero. In fact, that's already being done to reduce congenital anomalies.
Whatever the next innovation in plastic surgery may be, the best and the brightest who take on the challenge have incredible examples to follow. Pioneering cleft lip repair, Ralph Millard. The father of microsurgery, Harry Bunke. Master of craniofacial surgery, Paul Tessier. And the thousands of ASPS member surgeons who are essential contributors, respected by their colleagues, their patients, and their patients' families and friends. Every day, ASPS member surgeons show their commitment to improving the lives of their patients.
As one of the OR nurses, one of our rotations was through plastic surgery. And I was so impressed with the leadership of our plastic surgeons and our department head that led me into plastic surgery.
You do end up in circumstances where you thought things were going to happen a certain way and they don't really happen that way once you really start doing it, and you really do have to think on your feet.
Probably the single case that I feel the best about is a little 16-year-old girl that was brought over from Sierra Leone. She basically was told not to come to the high school because it was too difficult for the other kids to look at her. This was a benign tumor, but it encompassed her orbit, her cheek, her teeth, her nose. We did a 20-hour operation. transfused 12 units of blood, but she comes into my office today wearing a leather jacket with a beret on her head. She's going to nursing school.
Plastic surgeons change the way people feel about themselves. And no one knows that better than the patients.
When I was diagnosed with breast cancer, it's such a shock. I wanted to be able to wear my swimming suit, my competition suit. I said, I don't have to compete, but I have to swim every day. That's what I do. That's who I am. He said, Bunny, I would never take a swimmer's muscle. No, I wouldn't have thought of that. And I wasn't in any shape to think of anything, but he knew exactly what to do. And he did it. And Major Allen saved my life. Dr. Schutz saved me.
Now plastic surgery subspecialties have come together,
Can you raise your arm up?
promising an even brighter outlook for future patients and physicians.
Okay, we'll keep working on that to get that nice and loose.
Plastic surgery throughout its history has always involved many different aspects throughout the body. We deal with craniofacial defects, hand defects, burns, and as we became more and more specialized in all those areas, new societies sprung up as the research and the techniques became more refined. But we're all part of the big family of plastic surgery, and plastic surgeons still champion all those areas. And it's nice to see through the efforts of ASPS that recently all those societies are getting back under the big umbrella of plastic surgery and collaborating together.
The energy in organized plastic surgery has just increased. And the cooperation that we now have among all the societies is so good that I think there really is nothing that we can't accomplish if we just keep working forward.
It's because of plastic surgeons and the research they do that kids wear flame-retardant pajamas and drivers are protected by shatterproof windshields and seatbelts. Who would have thought that liposuction would reduce the suffering of cancer patients or Botox would help migraine sufferers? After looking back on our first 75 years, we ask, what's next? Some plastic surgeons hope to unlock the secrets of the womb, where the body heals without scarring. History tells us that what may seem unimaginable is often just a beat away.
That's when we know those lessons of history that we can look into the darkness and go even further.
The future's bright and the sky's the limit.